Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Manjeet Bora, who is Assistant Professor in Community Medicine, Assam Medical College, Dibrugarh. A very warm welcome to you, sir, on behalf of all the audience.
Thank you, madam, and hello, everyone.
And today we are going to talk on emergency contraceptive. We have already know about the contraception, but today we will talk about the emergency contraceptive. So without wasting any more time, I would like to know, sir, that what is emergency contraceptives?
So, emergency contraceptives, these are contraceptive methods which a woman can use to prevent unwanted pregnancy if she has any sexual intercourse without being protected by a contraceptive method.
What are the situations in which these contraception should be used?
Okay, there are a few situations. First is woman has any sexual intercourse without using any contraceptive methods. One is that. Second one is that the woman was using contraceptives, but she used it incorrectly, so that the method becomes ineffective. For example, she was using OCP pills, but she forgot to take 3 consecutive pills in 3 days, so the method becomes ineffective, and then she has to use the emergency contraceptive. Point is that there was a failure in the methods she used. For example, she was using, suppose, a condom at the time, but there was a breakage of condom. So she was using the method, but there was failure of the method. Or she may be going for a natural method like doing avoiding sex during the fertile period, but there was a mistake in the calculation of the fertile period. So in those situations also ECP comes. And lastly, any uh, sexual assault or rape, like that, those situations. So basically these 4 situations.
Okay, so what are the various available methods for this?
Okay, there are mainly 2 methods. One is there are different types of pills, and another one is the copper containing intrauterine device. And regarding the pills, they have different compositions. One of them is the levonorgestrel containing products specifically for emergency contraception. Then the progesterone only pills, those can be used, and also the combined oral contraceptive pills, those also can be used. But for today's discussion, we will mainly be confining to the levonorgestrel containing emergency contraceptive pills. And I'd like to say that these pills, they have been approved by the Drug Controller General of India, and for use as a dedicated product for emergency contraceptive pills. So they are available in specific dosages for this purpose only, both in the health system, those which are available with the ANM, ASAs, and the health workers. And also they have been marketed by different pharmaceutical companies for this specific purpose, for emergency contraception.
Okay, so now I am a little bit more curious about how does it act actually.
Okay, we are talking now about the emergency contraceptive pill. So how it acts is that first we know how pregnancy occurs. So pregnancy occurs, we need the egg from the ovary to be fertilized by a sperm from the male. So when the emergency contraceptive pill is taken, it will prevent the release of the egg from the ovary, or it will delay the release of the egg 5 to 7 days. Okay, so even if the sperm comes, it will not survive in the female genital tract for more than 5 days. So this fertilization will not occur. So mainly the mode of action is it prevents the release of the egg. Okay,
Okay.
so
Okay.
this is how it acts. And another
Oh,
thing here is that if pregnancy already is there, it will not affect it in any way. That means it will not disrupt a already existing pregnancy. Similarly, also, if the egg is already released and it is fertilized by a sperm, it will not prevent implantation. Okay. So those,
so when to take these emergency contraceptive and how to take?
yeah, that is very important. So regarding the timing is very important. It should be taken within 72 hours of unprotected sexual activity. But the thing is that it should be taken as early as possible so that it is more effective. The time window is, of course, 72 hours of unprotected sexual intercourse, but as early as possible. And how we calculate the 72 hours, if we may ask, so it has to be calculated from the time of the first unprotected sexual intercourse.
And how much effective it will be?
So regarding the effectiveness, it is 85% effective. So if we see what it means is that out of 100 women who will be taking it, 85 will not have the pregnancy. But there is a chance that in some cases it may not be effective. So about 15% it will not be effective.
Okay. So is there any specific dose for this, or a person needs to go to the hospital and consult to the doctor and then she needs to take that only?
The dose, it is 1.5 milligram of levonorgestrel, and it has to be taken as a single dose. And there is another regime where you can take 0.75 milligram in 2 doses, 12 hours apart. And regarding the doctor's prescription, this is usually available as a over-the-counter medication, and the government has in 2003 or I think in 5 they have given that it can be used as over-the-counter medication, but it is better to visit a doctor so that he may see the health condition and take any necessary precautions.
Okay. And I have heard that every drug, every medicine have some side effects. So what are the common side effects of these methods?
Okay, the drug is usually very safe and well tolerated in most women. Most women will not have side effects, and even if there are, they will only be for maybe 1 or 2 days. So the common side effects are usually nausea, vomiting, and pain abdomen. Then some of the women, they may have some spotting or bleeding after taking the tablet. And also another thing is that the return of mens after taking the tablet, in some women, the timing may be delayed or may occur a few days earlier. So those are the common side effects.
And how to get relieved from these side effects?
Yeah, regarding these side effects, regarding nausea, usually no anti-nausea tablets are required. However, if she had taken a emergency contraceptive previously and had nausea, this time around she can take an anti-emetic or we say anti-nausea tablets she can take. And regarding vomiting, if she has vomiting within 2 hours of taking the tablet, she may have to repeat the whole dose again because the tablet may not get absorbed. And regarding the spotting that occurs a few days after the taking the tablet, it occurs in some women. So it is not menses, it is a normal occurrence, and nothing really has to be done about it. And regarding the return of menses following the tablet, in some women, the actual timing of the next mens may be delayed, whereas in some women it may occur a few days earlier. The main thing to note is that if it is delayed more than 7 days from the usual, so it may be that she may have gotten pregnant, so she has to get the pregnancy test done. Otherwise, nothing has to be done.
Okay. And when will fertility be returned after using these emergency contraceptives?
So fertility after taking the emergency contraceptives is immediate. Okay, so once she takes the tablet, it protects her from pregnancy in the from any sexual activity in the previous 3 days. But after that, if she again engages in the sexual activity, this tablet will not be effective. So if she has any intentions like that, then she has to use a regular method of contraception, some other method.
Okay. So the last question from in my mind is that what to do if pregnancy occurs even after using these emergency contraceptives? In that case, a person what should to do?
Yes, as we have already talked about the effectiveness, it's about 85%. So even if women take correctly, there is a slight chance that someone may get pregnant. So the thing here is that even if the pregnancy occurs, the ECP tablet will not cause any harm to the fetus. So she may continue with the pregnancy and consult with a gynecologist and may do whatever is necessary for continuing the pregnancy. Otherwise, again, she may consult a gynecologist and go for medical termination of pregnancy as may be required.
Okay, sir. It was really nice talking to you. Any additional information you want to give to our listeners? Any go to home message?
Yes, main important points are it is safe in almost all ages women, even if the woman may not be able to use OCP or the progestin pills, but still she can safely use these emergency contraceptive pills. Again, these tablets do not cause any birth defects if the pregnancy occurs and pregnancy is continued. And regarding women in who is breastfeeding, she may also use the tablet. So those are the main points I'd like to highlight.
Thank you so much, sir. Thank you so much. I really hope, I really wish that this video will be very much useful for the women who got somehow got caught in this type of situation.
Thank you, ma'am. Thank you.